Welcome to another installment of LEX 18's Digital Conversation. I'm Davidson. AVOL has been serving our community and advocating for the rights of those in the LGBTQ community, as well as those living with AIDS and HIV. While there's still much to do, there are some strides that are being made to improve medical care and access, as well as provide opportunities, resources, and housing for those who are aging and underserved in the LGBTQ community. Joining me today to talk about the new affordable housing project and more, John Parker. He's the Executive Director of AVOL Kentucky, and Zach Worsham, COO, Winterwood, Inc. Welcome.
Thank you very much.
This is some exciting stuff that's going on.
Absolutely.
And you know, when we think of AVOL, we think of just the testing and the awareness and how we can get the word out.
Right.
We're doing pretty good with that part,
Absolutely.
aren't we? We're getting more people tested.
Absolutely, yes.
Medication is becoming a little bit more accessible, if not affordable.
And effective.
And effective.
Medication now can take people to places where they feel really healthy. They have very low levels of virus in the body, which means they have a very low chance of giving the virus to other people. Right. So in effect, treatment is prevention.
And it's not considered a death sentence by any stretch.
Absolutely, lots of management. And you know, stable housing has a lot to do with keeping people connected to medications and medical care. So it all kind of works together, and we've found ourselves connecting those dots for over 30 years.
And this is sort of a marriage made in heaven, if
That's
you
right.
will.
Yeah.
Let's talk a little bit about this, because we think about testing and medication, but we fail to sometimes remember that housing, and especially for those who are aging in this particular community, is so vital and isn't really available, is it?
That's right. There is a large shortage of housing in our community here in Lexington and in communities all across the country for housing that is meets a certain standard, and then more than that is even affordable to live in for people of a certain income. So we're thrilled to be part of the solution for that here and working with AVOL.
So let's talk a little bit about the housing that is going to be. Is this going to be apartment, condo, or some kind of mix of the two? Or?
Well, we are super excited that Kentucky Housing Corporation and our partnership with Winterwood and AVOL has had the opportunity now, and we know this is going to happen, to what we're calling Stonewall Terrace, which is a 26-unit apartment complex for people who are medically vulnerable, including those living with HIV. And I wanted Zach to tell us a little bit about how he and his family came up with this idea.
Okay.
Sure, yeah, we have been admirers and supporters of AVOL and the mission and the work they do for a number of years, and we saw a really unique opportunity to combine the work that we love to do in providing housing that's affordable for folks all across the Commonwealth, and the services that AVOL is able to provide those folks and the population that they serve.
Well, now, will it be sort of like when we think of assisted living, will it provide also access to medical personnel or nurses or things of that nature?
I mean, we're going to have support services and social services right on site.
Oh, good.
So that's going to be wonderful. And then UK Bluegrass Care Clinic is our medical provider, and they're just down the street. So we're going to be able to have quick access round the clock for the people that live there to the medical care and the support and human services that they need as well. It's going to be a whole community. We even have green space planned for it, and we are just so excited that over the course of the next 2 years we're going to be building and developing this. And I know human services and I know social work, but I don't know how to develop properties. So
is this the first of its kind in the nation, or in Kentucky at least?
It's certainly the first of its kind in the state of Kentucky.
Yes, absolutely. There's models elsewhere, and we've kind of looked at those over time. But as far as being LGBT, senior inclusive, and HIV sensitive, and medically vulnerable, this is the first of its kind in our area. Arguably, I'd love to have that argument.
Exactly. And this is so wonderful that your family wanted to partner with this. Is this something that is near and dear to your family?
It is. We are very supportive of the mission, and we are so thrilled that we get to be a part in furthering the work that John and AVOL has been able to do for 30 years. It's a great culmination of two long-standing organizations to be able to come together and see our missions converge into something that is really going to be game-changing, I think, for AVOL and its ability to operate, because one of the really amazing things is that AVOL with this project will have its own office space and community space to call home, and that will be a first. And then just to further the mission of affordable housing in our city, to be able to build 26 units for people who are making less than 60% of the area median income, where there really are limited opportunities for those folks, medically vulnerable or not, to find an affordable place to live.
To live, and a safe place to live.
That's right.
Now, we're going to be focused on Lexington, but do you think you'll move out into some of our surrounding communities who are also underserved as well?
That's right. We would love to continue this project as a model that we can take into other communities. We would love to be able to take the success that we have here in Lexington, where we're both based, and move out into the Commonwealth further, and provide more opportunity to serve folks all over AVOL's spectrum.
And we serve 71 counties
as
it is, so some will come to Lexington and come and move in with us. Others, we've had conversations already. Of course, one project at a time.
Exactly, because we can't have everything all at one time.
But in some of the outer counties, a similar project would be amazing and certainly needed. I was going to share one more thing, another first related to this project. You want to know what that is?
I want to know what it is.
So nowhere in Kentucky is there a permanent HIV memorial or AIDS memorial or anything like that. And part of this project is going to be a permanent HIV meditation garden where we can now pay tribute in a permanent location, and families can get involved. Friends who lost their friends and family can get involved. And we're really excited about the green space that will be part of this project as well, and accessible to the public, and we're really wanting a lot of involvement. It's exciting.
I mean, now, was this something that came out of conversations that people were saying that there's no place?
Yeah, I started looking at other states. In like West Virginia, they have a nice meditation garden right near their state capital, and I started looking around Kentucky, and we just haven't got there yet. But I thought with this space, and we've always rented our space, so we never really had control of the property. But this is going to be something that AVOL owns, and we've got those connections over 30 years that we can re-engage, bring people back, have the conversations about what that's going to look like and how can we best pay tribute to this very difficult part of our past, but a part of our past that needs to be remembered and honored.
Exactly, and for people to be able to have a place to come back to collectively to share and to remember.
Absolutely.
But 30 years? Are we getting that old? Has it really been 30 years?
Yeah, it has. And, AVOL was not the first initiative in Lexington to address this issue. So you had 5 or 6 years of active development of programming before that. And, of course, there was a period of time even before that when we didn't know what to do and how to respond. And I keep telling people that as difficult as it's been, we have learned a lot. And if we have other issues come our way into the future, I know AVOL's ready. And I think the community is ready as well.
Oh, for sure. I think we have seen in at least the 20 years that I've been here a drastic shift to more inclusiveness and more open and sensitive dialogue, if you will.
And we're really excited. There's a group in town called Sage of the Bluegrass, and they're focused on LGBT seniors because there's a lot of social isolation that happens as people in the LGBT community age, and getting them involved in this project and potentially living there.
Well, how can people get it? Because you're telling me something I've never heard that.
Sage of the Bluegrass. So you can connect with them through AVOL Kentucky, our website, avolky.org, and they're going to have their own website soon. But we can start to bring those conversations together as well, because we want to get everybody involved in that. We want to start having regular activities for people who are seniors who just don't get out much, and we might have senior night at the Kentucky Theater and just get some people out, make sure everybody has rides.
Let's not
and
call
get
it
them out
senior
there.
night.
Whatever.
Fabulous. What do we call it? Fabulous. Those who are fabulous are getting out. Yes. Oh my gosh.
30 years. It has been a long haul.
Yeah, it has. But we have so much further to go.
We do. I keep saying AVOL's mission is to end HIV in Kentucky, and I keep adding for good, and I keep saying, isn't it about time?
Yes.
Yeah. You know, it's like. We have the ability to do this. We just need to really focus our minds on it and make it happen. We want to do it.
And this will further to take away stigmas.
Absolutely.
You know, and improve the self-esteem and self-worth of individuals who are now facing a disease that once upon a time everybody would be doing this or thought it was an immediate death sentence, and we're seeing people living longer, fuller,
Full
healthier lives.
Absolutely.
Yes, indeed.
Yeah.
This is
And
wonderful.
now 1 in 7 people living with HIV do not know they have the virus. So one of the things that we offer at AVOL is free HIV testing as well as Hep C testing and other STIs. So I want to encourage everyone to live your life to the fullest. Make sure you know your status.
Right.
If you've ever been at risk, or if you need to just talk about it with us, we can kind of evaluate with you and get you in and out in less than a minute.
And it's important, it's not
Yeah.
just a gay disease.
Absolutely.
This affects everyone.
Everyone.
And should be, I think it should be a part of everybody's yearly.
Regular,
Go ahead and do it.
right.
Because to know you can get early intervention. And you
Absolutely.
can make all the difference.
faster we can move people to the medical care once
Yes.
they are tested
Diagnosed.
positive, we can do so much to help prevent a whole lot of heartache along the way.
Exactly.
And we were sort of doing this at the beginning of the year when everyone's kind of focused on regaining their health because we blew it in the holidays.
Yeah.
And and we thought, what a better way to say, well, while you're going back to the gym, make sure you go back to the HIV testing as well and just check in with us.
And it's confidential
Absolutely,
information.
completely.
And then housing, will people will have terms, I guess, would it be like a 6-month lease, a year lease? How do you do, have you worked that part out yet, or?
People can stay as long as they
That's right.
want.
Okay.
That's right. There,
Yeah.
it's a permanent housing facility
Okay.
Yeah.
for people to live as long as they choose
wanna
to stay.
choose to Okay.
That's right.
But you get a lot of folks who, once they get sort of on their feet and
transition.
stable, they're kind of like, hey, I'm ready to go and
Buy a
live
house.
over there
Right,
or whatever,
exactly.
buy a house
Right.
and kind of move on into that independent
And that's
world.
what we want them to do.
Absolutely,
right?
yeah.
Okay.
And we see that all the time.
That's awesome.
We created a little house called Solomon House a long time ago, almost as a hospice. But now people graduate, and they go and live independently, and we just
yeah.
see that miracle happening, and it's just really wonderful to be a part of.
That's awesome. Gentlemen, thank you so very
Thank
much
you.
for
Thank
stopping
you.
by. This is awesome. I can't wait to talk about it again.
Awesome.
And thank you for watching this LEX18 Digital Conversation. For more, just log on to lex18.com. Until next time, I'm Dia Davidson.